Hi, welcome. Thank you for being here. So, the basis of this whole thing is to prepare professionals to help their clients prepare for chemical peel season. Now, in all actuality, there's no just a season to do chemical peels, right? So, and I say that because you can receive a chemical peel at all seasons around, okay? So, with that being said, moving further, let's go ahead and get started. So let me allow me to introduce myself. So my name is Brittany. I am a registered nurse, a licensed esthetician, and a certified laser technician. I specialize in skin of color, so multicultural skin disorders, and I help correct those disorders using the different modalities such as lasers, PRP, microneedling. Botox is also one of my specialties. So those are things that I do. I'm located here in Douglasville, Georgia, and I just want to provide result-driven skincare for all skin colors, regardless. However, I do have a focus on skin color. So my girl Abby, who is the owner of Esthetician University. So Abby can be here with us on this recording. However, she is a spa award winner. She's a wax professional. She is a spa leader, a certified business mentoring. So if anyone's looking for business mentoring, Abby was literally my first mentor who showed me how to get the bag. Okay. So moving forward, so why are you here? You're probably like, oh my gosh, why am I taking this? Why am I watching this? So this is for professionals and non-professionals. And I say that because it's very important that us as professionals educate our clients on the basic information as far as what a chemical peel is, how when you receive it, the best time to receive it, the best time during the process, what to do before and after. It's just a lot of information. And I feel like clients fail because of a lack of education on our part. So we have to be more stringent in educating our clients when it comes to chemical peels. So I'm going to click on a couple of these. Okay, so I'm gonna allow you guys to click on these on your own. I'm gonna go ahead and upload this presentation in the comments. No worries. Okay, so the objectives. So what is a chemical peel? Okay, we're going to learn what a chemical peel is, the difference between a light peel, superficial peel, a medium, and a dark peel, the benefits of a peel, contraindications, and the best skin prep to reduce adverse reactions, what is expected during and after a peel, and then you stay tuned. I have a bonus. Okay. So that's where we'll take a deeper dive into the bonus includes a deeper dive for non-professionals and also a deeper dive for professionals. So stay till the end and I'll have a special bonus for you guys. So let's start. What is a chemical peel? So a lot of people don't they know what a chemical pill is based off social media, but they don't really understand the concept of what a pill is. Okay, I think it's very important that we have these conversations with our clients so that we can educate them. I feel like failure comes from a lack of education, and we start that education process very early on, our clients will be a lot more successful. Okay, so what is a chemical peel? A chemical peel is a chemical agent that dissolves dead skin cells. Okay, so when we think about it, the average skin turnover rates for babies are 14 days. For teenagers, it's 21 days. And as we get older and older, it becomes 28 days to 42 days. And as we get older and older, it's 42 days to 82 days. And what that means is essentially that as we're young, We have that fresh new baby skin that is glowing, that is has less wrinkles, that is just flawless. Well, we have that skin because our skin cells are literally shedding itself sooner, about every 2 weeks. So when you were young, you would fall, you would injure yourself, your skin would become damaged, you would get probably like a scar, hyperpigmentation area. Well, that area would eventually dissolve and lighten up and just rejuvenate itself on its own, right? And that's because our cells, our dead skin was shedding off by itself. So the goal of skincare is to maintain that cellular turnover rate because it will help you get rid of bacteria, help you get rid of dead skin cells. It will give you an overall flawless glow, a more even complexion and tone. And that's what we're all looking for. Okay. So that's cellular turnover rate. So when it comes to chemical peels, there are different types of dissolving agents that will help dissolve that skin. So you can do it mechanically. You can, and that consists of like microdermabrasion, hydrodermabrasion, dermaplaning, things of that nature. You can also do it with the enzyme, or you can do it with the chemical. And what a lot of people don't understand, or maybe they don't realize, that these chemical agents are acids. So you are essentially putting an acid on the face. So you have to be very, very gentle when it comes to particular clients. You have to know the client's skin. If you are going to a professional to receive a chemical peel, it's very, very, very important to make sure that that clinician understands your skin concerns, and your skin goals. So this is not necessarily a first time treatment type of deal. Me personally, this is not something that I would do on a first time treatment. And I say that because I don't know what you have been using as far as your home care in the last 2 or 3 days, or even within the last 2 weeks. For instance, if you're using something at home that may be contraindicated to the ingredients that's in that chemical peel, it's going to cause you a bad reaction. Number two, if you are, or your client is having big events coming up, you don't want their skin to literally be falling off during that time. You have to get to know your clients' lifestyle and etc. For instance, clients who do CrossFit or do HIIT exercises or hot yoga or those type of things, you have to know your clients' lifestyle. You have to know that your clients are committed to this, I would say, this month process. And I say a month because when it comes to the clients of skin and color, you have to prepare their skin for these advanced treatments. Because if you don't, that's where the client will say, oh, I'm allergic to this, or this happened, this bad reaction happened, I had this terrible experience, because their skin wasn't ready to receive what you gave it. Okay. So moving forward, so let's discuss light, superficial, medium, and deep peels, and how to choose the best. So if you are a client, usually your clinician will know what peel works best for you. So for myself, I always start my clients on a skincare routine. My clients have to buy the skincare products from me, because I know that my products will work well with the peel. It will not cause an adverse reaction, and they'll get better results. They have to start this at least 3 weeks before we do the peel. We're preparing the skin to receive this acid, right? And then after they have received this information, they receive their home care kit, they're doing their home care on a regular basis. Then we'll move into a light peel. That's why I do like a sensitive peel. And that peel will essentially not actually peel. So that could be anything from an enzyme peel to a very light, gentle peel. And we'll go into farther. And then if that client skin will receive that peel at a tolerable level, and things go as we plan, Then we'll move forward to the medium peels. So let's explain what that is. So superficial peels, light peels, medium, deep peels, right? So a light peel will remove the cells from only the stratum cornea level. So let me move slide over to the slide. So when you think about the stratum cornea level, the stratum cornea level is literally the layer that's right here on top that we see with our eyes. So if you put a peel on there, whether it's a enzyme peel or it's a light gentle peel, only the surface area will be clear. It's not getting deep down into the skin far enough to correct a lot of problems. However, it does help. So when we talk about superficial peels, it creates a necrosis, which is destruction of the tissue, a part in the part of the epidermis, right? So here's the epidermis. The epidermis is the layer underneath the stratum cornea. So therefore, we're going a little bit deeper, this layer right here, okay? And so that's where a lot of clients will have a lot of pigmentation issues, especially clients' skin of color. And so that's where they get the hypo or the hyperpigmentation, the discoloration. This is where a lot of the damage happens in this area, in the epidermis. So medium peels. Medium peels are usually what clients go after because they see on social media the results that people get when they get these name brand medium peels, which is usually a medium peel. So the medium peels penetration will create necrosis of the epidermis and part of the papillary dermis. So going back to this picture, that's where we get, so you see the epidermis is right here, this pink line right here, and then the dermis and the papillary line. So that's where you get a little bit of these capillaries down deep in here. Now, some people do have pigmentation problems that stem deep below the skin. That's why it's hard to get rid of the hyperpigmentation. That's why it's hard to get rid of some of those old scars because their scars lies deep. This is another reason why it sometimes will require 3 or more peels, because if you just do a light peel, it's just going to get the surface. So on surface, the hyperpigmentation area will, go away for a couple of days. But once that skin sheds off and then the next 28 days come, then that hyperpigmentation area is going to reform again. And then, so that's why you do multiple peels. When I do peels, I like to make sure that my client understand we're going to do at least 3 peels. And that 3 peels, we're going to do it every 28 to 30 days. So we have this window that we know that we want our skin to turn over. And so every time that new skin comes, I want to go ahead and treat the areas, especially the areas that we have under concern. So, and sometimes those areas can be deep down into the papillary layers. So then you have a deep peel. Deep peels are not very popular these days, simply due to the matter of a lot of people are working in deep peels usually require a longer period of recovery time. So deep peels are performed primarily under medical supervision. It creates a necrosis of the epidermis and the papillary dermis, which extends to the reticular dermis. So that is pretty deep. Okay, you getting really deep down here into you getting close to those the vessels, those veins and arteries down in your skin down here. So that's where you will see people who have a chemical peel. This is usually when they're bleeding and things of that nature. And it's not because anything's wrong, but because they went deep down for this peel. Nowadays, most people do like fractional lasers and such because it's a shorter recovery time, but it works pretty much in the same location. So there's the multiple pills. I hope that makes sense. I hope that was easy to understand. It's a lot of information here. So moving forward, let's talk about the benefits. Let's see. Okay. So this right here is a great example of how the peel is supposed to penetrate and correct the issues. So let's play this again. Let's see. I'm going to go back and then come back. Okay, so you have the chemical peel penetrating to the skin. It helps this layer right here. Depending on how deep the peel is, it will go to the other layers of the skin. Okay, so that's essentially how the peel is penetrating to the skin and how it corrects a little bit. Okay, so the benefits of the peel. Why is it worth it? I will be honest and say a lot of my clients, we have to schedule peels in their schedule. And I say that because a lot of my clients are professionals. They work in a professional setting where they cannot necessarily take time off or go into work with a hat, glasses, and a mask because they're in a type of environment that they work in. So they have to like take some days off, get a vacation day or things of that sort so they can have the actual time of peeling. And so a lot of people see that as not worth it because it's a lot of planning that comes with it. However, there are ways for my clients who cannot peel. We've developed a 6-month treatment to get their skin to peel without their skin actually peeling. And that's on a different topic. So let's just move forward with this one. So yeah. So benefits of chemical peel. So why is it worth it, right? So the chemical peel will lift the pigment from the skin. You need at least 3 because you don't necessarily know how deep that pigment that you are trying to get rid of or how deep that wrinkle is that you're trying to get rid of. And you want to make sure you do at least 3. I always tell my clients we're going to start with 3 and then we're going to determine if we should move forward. But if you stick with this treatment plan, I know you will see a great difference that you will be happy with. And a lot of people think when they get that one peel, it's like, oh my gosh, that dark mark is gone. Thank you so much. Well, then in the next month or month and a half, when that pigmentation shows back up because your skin is no longer shedding as quickly, then you're like, oh my gosh, I need to get another peel. So in order to get long lasting results and the best results, it's best to do 3 peels. Okay, and so peels will also improve the texture of the skin. It will help rejuvenate the barrier function and the moisture tension. So when we have a lot of wrinkles, when we have a lot of pigmentation, sometimes our skin gets blocked and cannot receive the ingredients that we're trying to put in it. And so the chemical peel helps reshed our skin back to a basic foundation where we can receive the ingredients that we're trying to use to correct our things that we need to correct. And we talked about this before. It increases cellular turnover rate, the hydration, and intracellular lipids. Again, hydration, hydration, hydration. Reduces fine lines and wrinkles and surface pigmentation. We talked about that. And notice that I put surface pigmentation because I said that when I first got to the slide. Whenever we're doing just one peel, all we're doing is getting rid of that surface pigmentation. That pigmentation may be a little bit deeper, and that's why we have to do 3 or more. Skin that looks and feels smoother. Yes, who don't want baby skin? Improves skin conditions such as acne, hyperpigmentation, clogged pores, and dry skin. Potential stimulation of the elastin and collagen production. If it's a deeper peel, it will definitely cause injury to the skin, which improves the collagen and then the elastin will start to kick in.